Life after 70 is fragile, and sleep, something that should restore and heal, can become a silent danger. We often take our bedtime habits for granted, unaware that small, seemingly harmless routines may be chipping away at our health. The reality is that the body does not function the way it used to. Recovery is slower, the heart is more vulnerable, and bad habits that were once tolerable can now be deadly. The story of a 71-year-old man who passed away in his sleep last night is not unique. It is a warning, a call to examine our choices and make adjustments before it's too late. If you are in your 70s or know someone who is, there are 4 bedtime habits that must be eliminated immediately. These habits, when ignored, increase the risk of heart failure, strokes, and respiratory complications. Many people assume that longevity is all about good genes, but in reality, it is built through conscious, disciplined decisions, especially at night when the body is at its most vulnerable. Eating heavy meals before bed is a silent killer because the body's ability to process food changes as it ages. Metabolism slows down, digestive enzymes become less efficient, and the body takes longer to break down complex foods. When a heavy meal is consumed late at night, the stomach is forced to work overtime while the rest of the body tries to transition into a state of rest. This imbalance creates a strain that goes unnoticed in the moment but accumulates over time, leading to serious health consequences. One of the most immediate effects of eating heavy meals before bed is acid reflux. When the stomach is full and the body is lying down, stomach acid is more likely to travel up into the esophagus, causing discomfort and irritation. Over time, chronic acid reflux can lead to conditions like gastroesophageal reflux disease, GERD, which increases the risk of esophageal damage and even cancer. People who dismiss frequent heartburn as a minor issue fail to recognize that it is a symptom of a larger problem that worsens with age. Beyond digestive discomfort, late-night eating significantly impacts heart health. Heavy meals lead to spikes in blood sugar and cholesterol, both of which contribute to arterial plaque buildup. This increases the risk of high blood pressure, heart disease, and stroke. When the body should be repairing itself during sleep, it is instead forced to process excessive calories, fats, and sugars, placing unnecessary stress on the cardiovascular system. This kind of strain is particularly dangerous for individuals over 60 whose hearts are already more vulnerable. Sleep quality is another casualty of heavy nighttime eating. The body enters sleep to restore itself, but when digestion is still in progress, it disrupts the natural sleep cycle. Instead of entering deep, restorative sleep, the body remains in a state of semi-activity, struggling to break down food while also trying to rest. This leads to frequent awakenings, poor sleep quality, and an increased risk of insomnia. Over time, sleep deprivation weakens the immune system, accelerates cognitive decline, and increases susceptibility to chronic diseases. Blood sugar regulation also suffers when heavy meals are consumed before bed. Late-night eating can cause glucose spikes, which are particularly dangerous for those with diabetes or prediabetes. When the body is at rest, insulin sensitivity is reduced, making it more difficult to regulate blood sugar levels efficiently. This leads to higher fasting blood sugar in the morning, increasing the risk of metabolic disorders. A person who repeatedly consumes heavy meals at night is unknowingly setting themselves up for long-term complications. Another hidden danger of nighttime eating is weight gain, which has a domino effect on overall health. The body burns fewer calories during sleep than it does during waking hours, meaning that excess calories consumed at night are more likely to be stored as fat. Over time, this contributes to obesity, which increases the risk of hypertension, diabetes, and joint problems. Many people struggle with weight gain in their later years without realizing that their nighttime eating habits play a significant role in the problem. Heavy meals before bed can also negatively affect liver function. The liver is responsible for processing fats, toxins, and other substances from the food we eat. At night, the liver should be focused on detoxification and repair, but when it is forced to process a late, heavy meal, it becomes overburdened. This increases the risk of fatty liver disease and impairs the body's ability to efficiently filter toxins from the bloodstream, leading to a higher likelihood of inflammation and chronic illness. Mental health is not spared from the consequences of poor nighttime eating habits. When digestion interferes with sleep quality, it leads to increased levels of stress hormones like cortisol. This can contribute to anxiety, irritability, and even depression. Poor sleep has been linked to cognitive decline, memory problems, and an increased risk of neurodegenerative diseases such as Alzheimer's. The connection between gut health and mental well-being is well documented, and disrupting digestion at night has serious psychological consequences. Hormonal balance is another area affected by nighttime eating. Melatonin, the hormone responsible for regulating sleep, is disrupted when digestion is still active during the night. Additionally, the production of growth hormones, which are essential for tissue repair and muscle maintenance, is impaired. This accelerates the aging process and weakens the body's ability to recover from daily stressors. The hormonal imbalance caused by late-night eating contributes to fatigue, increased appetite the next day, and overall reduced vitality. For those who suffer from inflammation conditions, eating heavy meals before bed worsens symptoms. Inflammatory responses in the body are heightened when digestion is prolonged, leading to joint pain, headaches, and muscle stiffness. Conditions such as arthritis and autoimmune disorders become more difficult to manage when the body is constantly dealing with the effects of poor eating habits. Inflammation is at the root of many age diseases, and late-night eating adds fuel to this dangerous fire. Another overlooked consequence of late-night eating is its impact on kidney health. The kidneys work to filter waste from the body, and overloading them with high-protein or high-sodium meals at night places unnecessary strain on their function. Over time, this can lead to an increased risk of kidney disease, particularly for those who already have high blood pressure or diabetes. The body's organs need time to rest and recover, and consuming heavy meals disrupts this essential process. Social and lifestyle factors also come into play when discussing the dangers of late-night eating. Many people develop this habit out of boredom, stress, or routine, rather than true hunger. Such as a light snack or herbal tea, can drastically improve overall well-being. Making small adjustments to nighttime eating habits can have profound long-term benefits, but many people fail to realize the damage until it is too late. Neglecting hydration before sleep puts you at risk because the body continues to function and repair itself even during rest. While people tend to focus on nutrition and exercise, they often overlook the importance of proper hydration, especially before bedtime. Dehydration does not simply mean feeling thirsty. It affects nearly every system in the body, impairing circulation, digestion, brain function, and even heart health. As the body undergoes its natural processes during sleep, a lack of hydration creates stress on organs, leading to a cascade of negative effects that accumulate over time. One of the most immediate consequences of dehydration before sleep is the thickening of blood. The body naturally loses water throughout the night through breathing and perspiration, and if it is already in a dehydrated state, the blood becomes more viscous. This increases the risk of clot formation, which is particularly dangerous for individuals over 60 who are already at an elevated risk of stroke and heart attack. Many sudden cardiac events occur at night or in the early morning, and dehydration plays a hidden but significant role in these tragic incidents. Another major risk factor linked to poor nighttime hydration is increased blood pressure. When the body lacks adequate fluids, blood vessels constrict to compensate for lower blood volume, forcing the heart to work harder to circulate blood. This silent strain on the cardiovascular system contributes to hypertension and over time weakens the heart muscle. A simple act like drinking a glass of water before bed can help maintain stable circulation and reduce stress on the heart, yet many people neglect this habit, unaware of the silent damage it causes. Brain function is also affected by dehydration during sleep. The brain relies on proper hydration to remove toxins through the glymphatic system, a crucial cleansing process that occurs primarily at night. When the body is dehydrated, this system functions less efficiently, leading to the buildup of harmful waste products. Over time, this can contribute to cognitive decline, memory issues, and an increased risk of neurodegenerative diseases such as Alzheimer's. The brain requires water to function at an optimal level, and depriving it of hydration weakens its ability to perform essential processes. Poor hydration before sleep is a leading cause of nighttime muscle cramps. When the body lacks water, electrolyte imbalances occur, particularly with minerals like magnesium, potassium, and calcium. These imbalances cause muscles to contract involuntarily, leading to painful spasms that interrupt sleep. Many older individuals suffer from leg cramps or restless legs at night, often unaware that dehydration is a primary culprit. Instead of resorting to medications or supplements, simply ensuring proper hydration before bed can significantly reduce these disturbances and improve sleep quality. Kidney function is another critical area affected by nighttime dehydration. The kidneys work continuously to filter waste and maintain electrolyte balance, and when the body lacks sufficient water, they must work harder to concentrate urine. This leads to an increased risk of kidney stones, urinary tract infections, and long-term kidney damage. Many people wake up feeling fatigued or sluggish, attributing it to age or poor sleep, when in reality, their kidneys are under unnecessary strain due to dehydration. Proper hydration supports kidney function and prevents complications that can become severe over time. Another often overlooked consequence of dehydration before sleep is its impact on joint health. The body's cartilage and synovial fluid rely on water to maintain proper lubrication, and when hydration is insufficient, joints become stiff and more prone to inflammation. This is particularly concerning for individuals with arthritis or age joint issues. Waking up with stiffness and discomfort is often seen as an inevitable part of aging, but in reality, something as simple as drinking water before bed can help maintain joint mobility and reduce inflammation. Dehydration also weakens the immune system, making the body more vulnerable to infections. Proper hydration is essential for the production of lymph, the fluid that carries white blood cells and other immune system components throughout the body. When dehydration occurs, this fluid becomes less effective at defending against pathogens. Older adults already have a weakened immune response, and chronic nighttime dehydration only worsens their susceptibility to illnesses such as colds, flu, and respiratory infections. Keeping the body hydrated before sleep is a natural way to support immune health and prevent frequent illnesses. Skin health is another area impacted by dehydration before bed. The skin relies on adequate moisture levels to maintain elasticity and repair damage. When the body is dehydrated, the skin becomes dry, flaky, and more prone to wrinkles. Overnight hydration plays a vital role in skin regeneration, helping to maintain a youthful and healthy appearance. Many people invest in expensive skincare routines without realizing that internal hydration is just as, if not more important in maintaining skin health over time. The respiratory system also suffers when the body lacks hydration at night. The mucous membranes in the nose, throat, and lungs require moisture to function properly. Dehydration leads to dryness and irritation in these areas, increasing susceptibility to respiratory infections, snoring, and sleep apnea. Many people experience dry mouth or wake up feeling congested without recognizing that dehydration is a major contributing factor. Ensuring proper fluid intake before sleep can help keep airways clear and reduce nighttime breathing disturbances. Digestive function also deteriorates when dehydration is ignored before bedtime. Water plays a crucial role in breaking down food and supporting bowel movements. Without enough fluids, digestion slows, leading to constipation and bloating. Many older adults struggle with digestive issues that could be alleviated by something as simple as maintaining proper hydration before sleep. Hydration supports the digestive system's natural rhythm, reducing discomfort and promoting regularity without the need for excessive medication or fiber supplements. Hormonal balance is yet another area affected by dehydration at night. The body releases key hormones during sleep that regulate appetite, metabolism, and stress response. When dehydration disrupts sleep quality, the production of these hormones is also impaired. This leads to increased hunger, weight gain, and elevated stress levels. Many people wake up feeling tired and irritable without realizing that dehydration has caused hormonal fluctuations. By prioritizing hydration before bed, the body maintains its natural balance, leading to more restful sleep and better overall well-being. Another hidden danger of dehydration before sleep is its effect on longevity. Chronic dehydration places long-term stress on vital organs, increasing the risk of age diseases and reducing overall lifespan. Studies have shown that people who maintain proper hydration throughout their lives tend to have better cardiovascular health, cognitive function, and physical resilience. Aging is inevitable, but the way it unfolds is largely influenced by daily habits. Hydrating before bed is a small yet powerful act that can significantly impact health and longevity in ways most people fail to consider. Sleeping in the wrong position strains the heart and lungs because the body is not designed to function optimally when compressed or restricted for long periods. The way you sleep directly affects circulation, breathing efficiency, and overall organ function. While many assume that sleep posture is simply a matter of comfort, it plays a crucial role in long-term health. Older adults in particular must be mindful of how they position themselves during sleep, as the wrong posture can exacerbate existing health conditions and increase the risk of cardiovascular and respiratory complications. One of the most dangerous positions for heart health is sleeping flat on the back with improper head and neck support. This posture can lead to airway obstruction, causing snoring and even sleep apnea, a condition where breathing repeatedly stops and starts throughout the night. Sleep apnea increases the strain on the heart by causing sudden drops in oxygen levels, leading to higher blood pressure and an increased risk of heart disease. Over time, poor sleep posture can contribute to long-term cardiovascular stress, even in individuals who believe they have no pre-existing heart issues. Side sleeping, while often recommended, can also be problematic if done incorrectly. Sleeping on the right side, for instance, has been linked to increased pressure on the heart. In individuals with heart disease or a history of heart failure, this position may worsen symptoms by restricting blood flow and making it harder for the heart to pump efficiently. The left side is generally considered more beneficial, as it reduces pressure on the heart and improves circulation. But even this position requires proper spinal alignment to prevent other complications. Improper sleeping positions also affect lung function. When the body is positioned in a way that compresses the chest, lung expansion is restricted, leading to shallow breathing and reduced oxygen intake. This is particularly concerning for older adults who may already have diminished lung capacity due to age changes or respiratory conditions like chronic obstructive pulmonary disease, COPD. Over time, poor posture during sleep can contribute to chronic low oxygen levels, which places further strain on both the heart and brain. Stomach sleeping is one of the most harmful positions for overall health, yet many people persist in it out of habit. This position forces the neck to twist unnaturally for hours, leading to spinal misalignment that affects circulation to the brain. More concerning is the pressure it places on the lungs and diaphragm, restricting the ability to take full, deep breaths. Over time, reduced oxygen intake during sleep can lead to fatigue, dizziness, and cognitive decline, making proper sleep posture an essential aspect of long-term health preservation. Poor sleeping posture can also contribute to acid reflux, which in turn affects the heart and lungs. When lying flat or in certain positions, stomach acid can travel back up the esophagus, leading to heartburn and irritation of the airway. This condition, known as gastroesophageal reflux disease, GERD, is common in older adults and can lead to chronic coughing, difficulty breathing, and even an increased risk of aspiration pneumonia. Sleeping with the upper body slightly elevated can help reduce these risks and support better digestion and respiratory function. Another overlooked consequence of improper sleep posture is its impact on circulation. When the body is positioned incorrectly, certain pressure points restrict blood flow to vital organs, including the heart and lungs. This can lead to numbness, tingling, and swelling in the extremities, as well as an increased risk of developing blood clots, particularly in individuals who are already prone to circulatory issues. Poor circulation at night can also contribute to restless legs syndrome, causing frequent sleep disturbances that further strain cardiovascular health. Sleep position plays a major role in how well the nervous system functions. The autonomic nervous system, which controls involuntary processes like heart rate and breathing, is influenced by posture. When the body is in a misaligned position, signals between the brain and the rest of the body can be disrupted, leading to an irregular heart rate and inefficient respiratory patterns. Over time, these disruptions accumulate, increasing the risk of developing conditions such as high blood pressure, arrhythmias, and chronic fatigue syndrome. Spinal alignment during sleep is another critical factor in cardiovascular and respiratory health. A misaligned spine can put pressure on nerves that regulate heart and lung function, leading to discomfort, irregular breathing patterns, and unnecessary stress on the body. Many people wake up feeling stiff or in pain, unaware that their sleeping position is contributing to systemic inflammation that affects more than just their back. Maintaining proper spinal alignment through supportive pillows and mattresses is essential for preserving both heart and lung health. Obesity and weight distribution further complicate the relationship between sleep posture and health. In individuals carrying excess weight, Poor sleeping positions can exacerbate the effects of gravity on the body, leading to airway collapse, restricted breathing, and increased strain on the heart. Many overweight individuals suffer from sleep apnea without realizing it, and a simple adjustment in sleeping posture can significantly improve their ability to breathe properly during the night. Elevating the head, sleeping on the left side, and using proper support can mitigate these risks and improve overall sleep quality. Sleeping in the wrong position also affects metabolic function, which in turn influences heart and lung health. Poor posture during sleep has been linked to disruptions in hormone regulation, particularly those that control stress and inflammation. When the body is misaligned, it can trigger a stress response that increases cortisol levels, leading to higher blood pressure, weight gain, and impaired immune function. Chronic stress on the body during sleep contributes to long-term health deterioration, making it crucial to adopt sleep positions that support rather than hinder physiological balance. The cumulative effects of poor sleep posture extend beyond nightly discomfort and can lead to severe health complications over time. Individuals who consistently sleep in positions that restrict breathing or circulation may find themselves at greater risk for developing conditions such as congestive heart failure, respiratory disorders, and even cognitive decline. While many focus on diet, exercise, and medical treatments as primary health interventions, the role of sleep posture in maintaining heart and lung function is often underestimated. Making conscious adjustments to sleep position can have profound effects on overall well-being, improving not only nighttime rest but also daytime vitality and long-term longevity.